Let's take a look at a quick demo of the software to see how these features really make NarrativePRO stand out. As we mentioned, the program is set up with a chronological flow. From the right, you can see the Responded tab, History tab, and Assessment all the way through Transport. One of the great features about this program is the multiple format capability. Whether you're a chart chronological writer or a SOAP writer, NarrativePRO can accommodate both. Under the Options section, there is a narrative format. Its default is chart, but you can select SOAP at any time. One note, we do recommend you select SOAP before actually completing your report or before starting the report. In this demo, I will document a call as real as I possibly can, highlighting some of the main features. Creating the narrative. I received a call by 911 and dispatched for respiratory distress, chief complaint, respiratory distress, but with weakness. All I have to do is put my cursor on the box and type weakness. So as you can see, I can take the options given and add in more specific detail. I can change anything about this that I choose. So the primary problem is respiratory distress, secondary problem is generalized weakness. Perhaps we were sent out by the other fire departments, or maybe your fire department guy runs mutual aid with the guys. They might have helped put the guy on the stretcher and provided oxygen prior to your arrival. Double-click the option and add in here 4 liters per minute. I'm taking the option it has given and adding more specifics. So you can see I can really make this program say exactly what I want it to. I can always use my own words. Click OK and let's move on. The patient was found lying on a bed at a skilled nursing facility. General impression was moderate distress. Patient was moved by a 2-person sheet lift and secured to a stretcher. I'm paraphrasing here as I want to give you an idea of how all this moves forward. Let's do high powers. I'm going to move forward here. History was provided by nurse and onset was 30 minutes ago. Okay, additional information is where you're going to explain the history of the patient. Perhaps it is a nursing home patient having some concerns about their breathing the last couple of days. Whatever that would be, that would go here. Moving on to who requested transport, the patient nursing facility. Now, I want to point this out. You can see I didn't select anything here, or I kind of select minimum things here. Part of the reason being is there are no mandatory fields. I don't need to be redundant. I don't have to enter in anything I wouldn't free type in my narrative. Moving on, perhaps the patient was oriented to person and place only, and this is normal for the patient. So one of the great areas the program has is its ability to help increase payouts and decrease denials in the mobility section. As a practicing paramedic, often we will be called to a nursing home to pick up a patient who is more likely bed confined or has some mobility issues. Maybe they have severe weaknesses, or maybe there is a hip fracture on top of hip precautions. Sometimes when crew members document these reports, they simply say the patient is being transported by ambulance. They fail to add a reason why. Here we can justify the transport, which helps you get paid for it. In this demo, the staff observed the patient has generalized weakness and can only be safely transported by ambulance stretcher. Now if I wanted to, I can customize this selection. I can reword it a little bit, but I'm happy with it, so I'll select Add. That is what will show up in my narrative at the very end. Select OK. Next is our head-to-toe assessment area. I want to jump right ahead into chest and respiratory, entering some pertinent positives and negatives. How about the patient's airway path, equal chest rise and fall, and no chest pain, and about how signs show the patient has lung sound diminished. As you can see, in this field, I get more information on the right side. This is an example of our dynamic field options. Under the patient information, I am able to add that the patient has bilateral diminished lung sound in the upper and middle lobes. We can see I also added some notes here as well. I can select anything like audible wheezing. I'm going to type in, but normal for patient. Alright, there's my selection. If you're happy with the way your EPCR treatment selection works, all you would have to do is select Treatment Documented Elsewhere and move on. Again, you don't have to repeat your treatment section. If you want to be more specific than what your EPCR will allow, then you can come into these sections here that will allow you to put that information in. We also have a CCT miscellaneous section that allows you to enter information such as arterial balloon pumps, arterial line and blood infusions. Now we move on to the reevaluate, or head-to-toe evaluation. The patient states the oxygen is helping and they are feeling better and breathing easier. I may want to add now following breathing TX. So there's my selection. Excellent. Ongoing assessment by attendant 1, and it's done every 5 minutes. Reevaluate notes will go here. With chest and respiratory, since we did an assessment of that just in the body region, let's just put that dyspnea is now resolved. And again, I can write some notes here, but let's move on. Transport. Let's mark without incident or delay. Transport via ALS. And we took the patient to the ER. Care was turned over to the ER nurse. Patient was moved from ER stretcher to ER cot by a 4-person sheet lift, and our IV line was patent with no swollen or discoloration at insertion site. We left the paperwork at the nursing home, and the receiving facility and all the patient belongings were turned over to the patient or hospital staff. The person taking over care did not have any questions. I always like to justify why or why not I did not get a signature. So perhaps the patient could not hold the pen to sign because the patient has generalized weakness. Again, this justifies why we cannot get the patient's signature. Nurse signed patient transfer on the computer. Again, the patient could not hold the pen to sign for HIPAA, but we went ahead and turned over the paperwork. That's it, we're done. I'm going to select who did the report. So let's use Derek as the report writer, and all I have to do is click on the Tell the Story, and you'll see that my narrative is compiled and bunched here. Let me scroll down so you'll see that. So this is about your typical length of a narrative that our software will produce for your average call. Some may be a little longer, some a little bit shorter. It all depends on the nature of the event. So once you're at this point, you're going to do a couple of things. First, I encourage everyone to read the narrative to make sure it says exactly what you want it to say. Once you've decided that you're happy with it or want to make changes, you can do a couple of things. So let's say under history, you want to add something because you realize that you forgot it. All you need to do is go back to history and add it. I'll add something here because we'll say this problem got worse since onset, and this is an occasional problem, and the last time it occurred was 5 months ago. Now go back to finish and tell the story, and you see that my narrative now has that new information. You can also go back to unselect something and make the change here. So once you create your narrative in the final narrative spot, you don't necessarily have to keep it. You can edit, change it, and move more information or whatever you want to do. One of the final feature lines I'd like to show you is this. You can go into this text box here and start typing. So even if you don't like anything in there, you can change in the middle of phrasing or the word by typing here. Now the question is, how do we get the narrative into your ePCR? All you have to do is click Save to Clipboard. And you know what I want to do is, actually, I'm going to delete everything out of here since I don't have an ePCR to present this on. We are going to assume this black typing area is the narrative section of your ePCR. So all you have to do is maximize your ePCR back up. Don't close it out, just maximize it. Go to your narrative writing section and put your cursor there and make sure you see your cursor blinking. Then you're going to do Control V, which is paste. Then it's going to drop down your narrative right into the narrative writing section of your ePCR. So once you complete your call, you lock and load it into the system, and this narrative that you see here is as if you have already completed it within your ePCR. If you're paper-based, all you have to do is select your print feature. You can put a trip number if you want or a patient name. Again, there's no mandatory field, so you put as little or as much as you want to. You can select a date of run, however it defaults to current date, but you can always adjust. Select OK to get your print preview. Then you'll select the printer that you want to print to. A couple of nice features about the program include saving your reports. If you take another call and you don't want to stop what you're doing, you can save it and come back to it. There's also an autosave feature so that if the computer freezes or dies and shuts down any other way than the normal shutdown procedure, the program will recover all that work that you have done until this point so that you don't lose anything. Another nice feature NarrativePRO offers is a built-in medical calculator. Here's an example. Our first calculation is 1600 of our concentration, and Medso ordered 700 mics per minute. Patient weighs about 87 kg and tubing 60. Press calculate. There's your grips per minute right here. So what's nice is, maybe you're not getting the therapeutic effect and you want to up the dose. All you have to do is make the change, hit calculate again, and it will recalculate your selection. Now the calculation you see here doesn't actually go into the report, it's just simply a tool that you can use. I hope you enjoyed the demonstration.